Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you another fascinating guest today who has been involved in creating a better tomorrow for so many people for over the last 40 years throughout her multifaceted career as a public servant, a scholar, a teacher, an administrator. Today we have the pleasure of being joined by the Honorable Secretary Dr. Donna Shalala, a professor emerita, Department of Health Management and Policy at University of Miami, where she previously served as president from 2001 to 2015, where during her tenure she advanced that university into the top tier of U.S. research universities around the country. Secretary Shalala received her bachelor's degree from Western College for Women, her Ph.D. degree from Maxwell School of Citizenship and Public Affairs at Syracuse. In addition to her leadership of University of Miami, she also served as both the president of Hunter College as well as the chancellor at the University of Wisconsin-Madison. Secretary Shalala was Assistant Secretary for Policy Development and Research in the U.S. Department of Housing and Urban Development during the Carter administration. In 1993, she was appointed by President Bill Clinton to head the Health and Human Services Department as United States Secretary, where she served for 8 years, the longest running HSA secretary that we've had, during which time she fought for the implementation and creation of the Children's Healthcare Insurance Program, or CHIP, covering over 7.6 million children throughout the country, doubling the budget of the NIH and securing the highest rate of immunizations that we've had. Secretary Shalala was also appointed by President George W. Bush to co-chair with Senator Bob Dole at the time the Commission on Care for Returned and Wounded Warriors. She received the Presidential Medal of Freedom. In 2009, she was appointed to the Committee on the Future of Nursing at the Institute of Medicine on the National Academy of Sciences. And most recently, in addition to serving in Congress for Florida's 27th Congressional District in the U.S. House of Representatives, she has also served as a member of the Council on Foreign Relations Independent Task Force on Emerging Global Health Crisis, as well as a commissioner on the Bipartisan Commission of Biodefense, formerly the Blue Ribbon Study Panel on Biodefense. We have a lot of exciting topics to go into with her. We're honored to have her. Secretary Dr. Donna Shalala, thank you so much for taking time to come on the show.
Well, thank you very much. My resume is longer than usually I'm willing to talk.
It would take up probably most of the show, so I had to cut it short. But I appreciate you being here. There's a lot of topics I'd love to get into with you. And I think one place I'd like to start off with, talking about the recent bipartisan commission. I took some time to go into to PubMed and go back in history and look at some of your peer-reviewed literature, and I came up with a bunch of papers that you wrote at the end of the 1990s. One entitled "Bioterrorism: How Prepared Are We?" One collaboration in the fight against infectious diseases, and then in Science you wrote an article on the research agenda for smallpox. That was 23 years ago, and these papers were, needless to say, quite ahead of their time for where we are today. Can you talk a little bit about what was going on? What were you thinking about back in 1999? Why you were so interested in this space, and a little bit of your journey into this sort of fascinating moonshot in terms of both the commission and then the Athena agenda for biodefense.
Well, the role of leaders is really to anticipate the future. And that's what I was trying to do at HHS. It was not simply the day-to-day firefighting that you have to do when you're a cabinet secretary, but it's really trying to get prepared for the future And it was very clear to me, both in immunizations as well as all the issues of biodefense. Um, you can talk about COVID, but diseases can be spread by other nations, by rogue nations, and I've always been interested in the role of infectious diseases and how they could be misused and create chaos around the world. And those early papers were trying to convince the Congress in particular, the administration was committed, that we really need to make investments in infrastructure in our ability to respond. Some of that came out of the NIH, doubling the NIH budget. If we had not done that, we would not have been prepared in any way for COVID. The vaccines for COVID came out of the basic research that was funded during the 1990s, probably the 80s and 90s. They created the platform for our ability to respond fairly quickly in developing a vaccine.
And you speak about the NIH and innovation. You a couple of years later, in Science magazine, you publish another article. It was entitled "New Directions for Biomedical Science." It was interesting. In this journal, you start off by actually quoting your mother at the time, who was 90, and she was said to you, "Hey, with all the money that we're giving to your famous NIH, how did they not know that anthrax was in some of those sealed envelopes?" And then you go on to talk about whether it was biodefense or stem cells or other cutting edge technologies. You go into sort of, what are the models, what are the new structures that we need to create these diagnostics, these life-saving treatments. Essentially, President Biden recently announced the development of this new Advanced Research Projects Agency for Health, sort of modeled on the DARPA model, to address some of these unmet medical needs. And one of the debates that I sort of saw right after that happened was this whole thing. Do we put something like this, when we talk about innovation, in the hands of the NIH and do it via that model, which has worked very well, or do we look at other models like DARPA, which does things fairly differently in the way they go after, whether it's defense or they also work on health and so forth? Talk a little bit about this area, if you would.
I actually see them as partners, and I've always been sensitive to the role of the private sector. We talk a lot about big pharma and their own pipeline. Their pipeline increasingly is buying licenses from the great research universities who have been funded by NIH and have developed close to products, but products that have to obviously need more work. And those, our array of great research universities combined with the NIH is what gives the United States really advanced technology and advanced science so that we can take on biodefense issues, as well as issues, just fundamental issues of infectious diseases. We already have a vaccine for monkey pox. We've been working on it for a very long time. Whether we have the production infrastructure or not is what we're debating now. There seems to be a small company in Europe that produces the vaccine. And that's in large part because, as I found out when we were trying to do children's vaccines and raise the level of children vaccines, Big Pharma is not very interested in vaccines unless you underwrite them, unless you guarantee them a market. They don't make much money on vaccines because, frankly, the production of vaccines is relatively inexpensive once you get what you need to do, even the more complicated ones. And it's developing the vaccine in the first place that's the expensive part. And but once you get there, they've got better things they think they need to do with their companies, unless the United States says to them, as presidents have, including Trump, starting with Trump, hey, we need you to reprogram all of your manufacturing because this COVID thing is worldwide. So I I think it's a public-private partnership and that you need different vehicles. NIH is always going to be the jewel that produces the fundamental research that we build upon. And NIH even goes a little further. They have some capacity to actually develop the vaccines themselves, but certainly a combination of public-private partnership, different kinds of investments, which is what DARPA does and what the new agency will do. We ought to pursue all three because at the end of the day, a single approach is not going to work.
And talking about the educational institutes, I mentioned in the intro, you were president of the University of Miami for close to 15 years, and during that time, and we've had several guests on the show, it became an epicenter for diabetes research. There's a lot going on there in terms of the neurobiology of opioid addiction. We'll get into that in a little bit. There's a major hurricane research and prediction center there now. Same at University of Wisconsin-Madison, a major hub up there now. You were chancellor, stem cells, regenerative medicine, and so forth. Could you talk a little bit about, as innovation, science and technology transfer has ramped up, how your role changed during that time? And obviously, you had the role, you're president, you need to educate people and bring in new students, but at the same time, these institutes, as you ran them, became these major engines, not just for technology development, but for economic development as a result of that. Talk a little about those dual roles that you serve.
I see the great research universities as economic energy engines, not simply of their communities, but of the United States. If you look at our array of research universities, they really drive, as does pharma and biotech more recently, they really drive the economy of the United States. They're relatively clean industries, by the way. So they're not like service industries where they have more low-paying individuals. They're really major hubs of scientific discovery and of taking science from the bench right to the patient. So those investments were critical, but I didn't see them simply as investments in producing vaccines and other kinds of treatments. I saw them for training the next generation of scientists. And one of the things that I always emphasized and reminded NIH is that, and they didn't need much reminding, is doubling the NIH budget was not simply roaring the economy. In fact, I told Bill Clinton once that his great legacy was going to be doubling the NIH budget because that was going to pay off for years to come. But it was training the next generation of young scientists. We have no competition. Everybody talks about China. They have a couple of research institutes that are interesting, or about Japan or about Europe. No one has our array or our muscle power or our investments in science. And we have to be careful about it because it's fragile. It's very fragile. And the research institutions are fragile. You have to keep the money going, not constantly doubling it necessarily, but ramping it up in a way in which you can guarantee that these young scientists will have opportunities in the future, both in great universities as well as in the private sector.
Secretary Shalala, in a recent January 2021 paper that you published, entitled "A Global Health Action Agenda for the Biden Administration," and you talk about obviously COVID has shown that our interests, as you mentioned, tied to other countries' health interests as well as our global health security, and then also in your the task force at the Council of Foreign Relations, it goes a little further in the sense that non-communicable diseases, which popping up all over the place, whether it's heart disease, cancer, diabetes, in some of these low and middle income countries, once again, feed into that cycle. We have disease, hunger, poverty. It's a nasty cycle that it might happen over there, but just like COVID, it's going to impact us over here. talk a little bit about this health action agenda. It was an ambitious one, but say a few words about why you wrote this.
Well, I think constantly making the point that it's not just about the United States. We are not safe until every country in the world is safe in terms of infectious diseases, even in terms of those kind of middle class diseases that people observe that are not infectious. And our investments here must roll over to make the rest of the world safe. But it's also a national security issue. I once debated with the great Jean Kirkpatrick at a conference on whether AIDS was a national security issue, because I was arguing that health is a national security issue. It impacted the military all over the world. And one of the reasons other countries started to notice that is because it impacted their young soldiers, and that created security issues. But it also was a security issue for us, and that we had to recognize and incorporate health into national security. I actually detailed a global health expert to the National Security Council. They did not have a full-time healthcare advisor there that understood the global health issues as they related to national security issues. Now there's a unit actually within the National Security Council, but we were the first people that actually put someone there so they would recognize that health issues, not just infectious diseases, but that health issues were related to national security.
Talking about health and national security, I'd like to move to the opioid crisis for a bit, because I had the opportunity now to attend a few of the virtual Clinton Foundation conferences on novel approaches to dealing with the opioid crisis, including faith-based organization involvement. You headed up the Clinton Foundation for a couple of years. You've also been involved in the opioid crisis task force at the Bipartisan Policy Center. I grew up in the late 1960s, early 1970s, and it seemed like drugs in general was an issue, whether it was number 3, 4, or 5, it was somewhere up there. This is your brain on drugs and so forth. I don't know where it is today, but as you point out, and you released the report, the Center Combating the Opioid Crisis, Smarter Spending, and the Federal Response. We got a big problem in terms of the numbers behind this issue, direct, indirect, and just the amount of people that it's killing every year now in the U.S. alone. Can you say a few words about sort of where the opioid crisis, in sort of your involvement over the years in government, sort of has fallen, why it's fallen, and some things we can do about it?
Well, I began to see the addiction to opiates on college campuses with students. Tragedies, one tragedy after another with overdoses. It wasn't just that I was running universities that had great medical schools and great research that was going on. It was, or that I understood that the pain, the politics of pain, led to opiates, and that we actually legally created much of this problem. Some of it was because people were trying to alleviate pain, and some of it was the absolute crime of the drug manufacturers themselves, the limited number that were actually selling and pushing these drugs. As you well know, there's a whole history here. But the opiate crisis is very different than COVID.
Sure.
There is no vaccine for opiate addiction. It is, if you are addicted, we need to stay with you for almost your whole life with services and with support systems. And it's not just a treatment program. It's more than that. It's a support system that's got to last for a very, very long time. And that's what we've learned about opiates. That once someone is addicted, then it's both a mental health crisis, as well as a housing crisis, as well as a job crisis, as well as a family crisis, all these pieces put together. We've put an enormous amount of money into this.
Yep.
Most of it, as our report points out, is in Medicare and Medicaid. That's not an integrated system.
No.
And so we've also put grant programs together to try to create an integrated system and try to urge the states to merge a lot of these grant programs in a way that will create supports, literally putting our arms around those that are addicted and sticking with them for a very long period of time. You never get over an addiction. Ask anyone who's been addicted to cigarettes,
Yep.
frankly.
Yep.
You never get, or to alcohol. You simply have to keep working at it, but you can't work at it unless you have a support system, and it's got to be more than just your family.
Appreciate that. Secretary Shalala, one of the things that I mentioned in the intro, while you were leading Hunter College, City University of New York, you had responsibility for the Brookdale Center on Aging. And the themes of healthy aging, longevity, geroscience have been very important topics on our show. And once again, as you led HHS, many of the sort of subordinate agencies that oversee sort of aging policy, science, and so forth from the NIH, the Administration of Community Living, obviously Medicare and Medicaid, and then indirectly FDA, fell under your purview. And this is an area that, one of the themes we touch on is something about called health span, that, if we could just not get rid of, but if we could just delay the biology of aging, which is responsible for dementia or cancer or heart disease or everything that falls under it, the returns to the U.S. economy, global economy, it's one of those areas where the trillion figure comes in. Yet we don't spend. I mean, the recent appropriations budget is about $4 billion for the National Institute on Aging, an admirable amount, but still small compared to the total NIH. Could you say a few words about healthy longevity, aging as sort of a policy issue, and then, thinking about the bipartisan commission and their $100 billion moonshot? If I wanted to go about a moonshot with you on dealing with the topics of aging, looking forward, how do we go about it? It's an important topic.
Well, in some ways we are going about it because we're focused on Alzheimer's and dementia,
right.
But healthy aging is more than just the science. Yep. It's wellness as well. And the private sector has developed a series of institutions, long-term care facilities, sure. Assisted living facilities, trying to adjust to people as their situation changes. And trying to build in support systems at the same time. You'll see a lot of this in Medicare Advantage, which has extra money to add services, whether it's dental services or exercise facilities, access to exercise facilities, or a much more integrated approach to supporting people that as they age. Age is just a number. And how we treat other countries have a lot more respect for those that are older. Yeah. My mother passed at 104, and boy, she played tennis into her 90s. She won tournaments into her 80s, and she was a very healthy individual. She didn't start getting dementia until her last year and a half, so I was very lucky. But I also saw the need for support systems, particularly if you want to keep your loved one at home. Yep. Home health care has been a big issue. It was a big issue when I was at NIH. But again, it's the integrated approach as people's situation changes. But it's also deep investments as we're trying to learn more about Alzheimer's and about dementia and about the other diseases that are related to getting older, whether it's stroke or heart attacks or all of those. There's a lot more money in aging than it looks like. Okay. I created the first assistant secretary for aging. Yep. Fernando Torres-Gil, who was one of the great experts on aging, I had met as a White House fellow during the Carter administration. I called him up because he was heading an aging institute at, I think it was at UCLA at the time, and said, "Hey, Fernando, would you like to come back?" And he said, "Only if you elevate the role of aging in the department." And I said, "We'll create an assistant secretary for aging." So he had disability and aging, not that they're necessarily the same groups, but he taught me a lot of, as I learned from the Brookdale Center,
Yep.
where I first ran into the real experts on aging in this country, both at Mount Sinai in New York, as well as Rose Dobroff, who was running the Brookdale Center at the time. So this is an area, yes, could we use more resources? The answer is yes, but there's a lot of work going on. It's just not pulled together in a way that gets from the bench to people. But this is an area where we've got a lot of resources and where the private sector is trying to respond, not just with appropriate housing, but with the kinds of services that people need so that they can have a quality of life as they get older.
Yeah, it's such an extremely important point in terms of the aging in place, social determinants. And, yeah, I appreciate you bringing those points into it because it's overlooked, I think, too much. Secretary, you're very passionate about nursing and nursing care. You've published on geriatric nursing, the expanded role of physicians' assistants, new models of nursing care. What got you so interested in nursing as an important topic?
You know, I had 3 nursing schools under me at Hunter, at Wisconsin, and at Miami. So I learned a lot from those deans. And from nursing is patient-centered, which is where we want the healthcare system to go. Their research is patient-centered. What they do in their approach is patient-centered. I've always seen them as the glue that holds the healthcare system together. Most people see a nurse, an advanced practice nurse, when they go to their doctor's offices. And I've seen the progress we've made in nursing is in understanding that this is a team approach, that if you're going to approach someone's healthcare, it's got to be a team. And they've got to be partners. Nurses cannot be handmaidens of the doctors. And in addition to that, I've always been interested in advanced practice nursing, nurse practitioners, because they can provide almost 70% of all the primary care in this country. We'll never be able to produce enough doctors to handle all of primary care. And by the way, if you look at red states versus blue states, there are a lot of red states that give nurse practitioners a lot more authority than blue states. It depends on the role of their medical societies. But the most progressive state may be New Hampshire in terms of the role of nurses. If you look at the Western states, many of them use nurse practitioners for primary care. And so this isn't a red or a blue issue.
Sure.
Unfortunately, or fortunately, the states have the authority over scope of practice. I believe strongly, and I've always believed, that people ought to be able to practice up to their educational level. The states determine the educational level, but not all of them allow people to practice, whether it's physician's assistants or nurses or pharmacists. Increasingly, we're allowing pharmacists to do a lot more. So I've been interested in all of these professions, nursing in particular, to expand their scope of practice as a way of integrating healthcare in this country and making sure that people have access to good healthcare.
Outstanding. I mentioned your involvement in the opioid crisis task force per the Bipartisan Policy Center, but you're also on the nutrition and physical activity initiative, the prevention initiative. Can you say a few words about that?
You know, if we could get people to stop smoking, to eat right, and to exercise, we could save a lot of money in healthcare. Yeah. People would live longer. I mean, it's almost low tech. In addition to that, throw in some vaccines, and we would be in a different place in terms of the cost of healthcare in the United States. And so I see all these pieces as critical, but in particular, the stop smoking, the exercise, and the nutrition as critical elements. We get too twisted around in terms of biomedical science and all the investments we must make. But at the end of the day, we have expanded life expectancy in this country through sanitation, building codes, vaccines, more than all of the investments in science. So in some ways, we have to make sure that we merge these two to understand. And now we've got the environmental issues that we have to deal with, which are also critical to extending life expectancy in this country. So we've got to pay attention to low tech as well as high tech. If you really care about lengthening life expectancy in this country and the quality of life that we want people to have, not only in our country, but around the world.
If I came into your classroom in September, what's on the itinerary?
Well, students are much more interested in the issues that they see. The environment, opioid, the politics of opiates, in particular, if you talk to students. Mm-hmm. I, of course, try to get them interested in the cost of healthcare and who's left out and the social determinants of health, sure, and who's left out of the healthcare system and the disparities in the system, which I have to coax them into. They have absolutely no interest in Medicare or Medicaid. Some of them have a little bit of interest in Medicaid if there's someone on their family has been on Medicaid for a period of time. They're really fascinated with Operation Warp Speed and COVID now. So the fact that I invite Alex Azar, the former secretary in the Trump administration, into my class to talk about how he did Warp Speed really turns them on. And he's very good at explaining the politics of big pharma and how you work through that to get vaccines up and off the ground and to millions of people around the world. So that's the kind of thing the students are interested. I'm deeply interested in how we take on healthcare costs so that we have a better distribution, and in the disparities issues. Health in relationship to the environment is a relatively new subject. Oh, yeah. And but the kids get it right away. The young people get it right away. They get excited about talking about it, about things that can be done, and about commitments that they have. And then I try to make them understand the high tech, low tech issue that I just discussed with you, the public health issues, but trying to get them interested in where we're spending the money. And how we're spending it. I have to drag them into that discussion.
You haven't taught them that it doesn't grow on trees.
And they want stories. They want to hear my stories about how did we get all the kids in the country vaccinated at the right time, and how do you really move mountains to do that kind of thing. It was the Clinton administration that brought RU-486 into this country through chance. Yep. The French company wanted to get rid of the license. They made a phone call to me and said, hey, would you take the license? And I said, the government doesn't take licenses like that. We found the Population Council to do the license, and then private sector people, the Buffetts, basically finance the clinical trials. And so the majority of abortions now in this country are actually medically induced, just from a phone call from a French company to the Secretary of HHS, to a willing Secretary of HHS. But I was smart enough to keep the government out of the politics of that and to let the nonprofit sector take the lead.
Excellent. And outside of the classroom, anything else that's hot for the rest of 2022, other places that we can see you, meet you, conferences you're going to be at, anything else that I missed, please?
Well, I sit on the board of Research America. I sit on the board of a couple of different schools of public service. I'm very interested. The Clinton School at the University of Arkansas, I'm chairing the board of that. They have a new dean that came from the University of Texas at Austin, who's Mexican American, and a dynamic new dean and a new way of doing public service that combines real getting kids, young people out working in the nonprofit sector, in the public service while they're going to school. And I think that that's important. I also sit on the board of my own school, the Maxwell School, which is ranked #1 in the country, which is an extraordinary school of public administration and public service, and has been for 100 years. So that I'm starting to talk to small companies in the Medicare business that are adding services. Just going on the board of a company called Chapter, which actually if you call them up and you're turning 65, they'll give you help free to pick the right plan for you, one that'll cover your doctors that's in your community. If you want to change that plan, they'll stay with you a year from now and help you do that. It's different than other companies. They pay salaries to the people that are advisors as opposed to bonuses based on who they refer people to. So it's a different attitude. They've taken so they get people at the right time to the right place, and it's run by 2 young, very outstanding entrepreneurs who really understand the healthcare business and want to make sure people get to the right place at the right time. I also read proposals for some of these a big investment company, and I can tell them whether they're going to make money. I can't tell them whether they'll make a lot of money, but adding services to Medicare recipients is very important, I think, because Medicare is a Chevrolet as opposed to a Cadillac. We've talked for a long time about the need for dental services and eyeglass services, but there are other things that people need as well if we're going to put our arms around people over 65 and keep them healthy as long as we possibly can. So I work with the private sector as well as with the public sector. I get lots of phone calls from people that want advice, and lots of calls from young people that want advice on how they can be the next cabinet secretary. I tell them to look around their classroom and figure out who's going to run for president.
There you go.
5 years.
Oh, that's very awesome. Secretary, so one last thing while I have you, I have to ask, when I go to your social media links, you post some videos of your dog, which happens to be named Fauci, and I was just wondering how that came about and if Tony is upset with that.
No, Tony said that Tony thought he was pretty cute. My dog was pretty cute. Unfortunately, he's at doggy daycare today. He has a girlfriend, so he likes going to doggy daycare, a Pekingese. My dog is a mutt. I've had dogs for years, and my other dog had died a couple of years before. And during COVID, a rescue group that I work with called me and said, "Hey, we got a little dog." I said, "I've never had a little dog." And they said, "Well, we picked him up. He was running around Coconut Grove. He's really cute, and you ought to come and look at him." And I said, "How small is he?" And they said 9 pounds. I've never had a 9-pound dog. I'm used to these 20, 30-pound big dogs. So I went to look at him, and he was really cute. And I said, "Where'd you find him?" And they said he ran into an Italian restaurant, so you have to give him an Italian name. So we were in the middle of COVID, and I thought Fauci.
There you go.
And he's adorable.
He definitely is. I just, I had to ask, but he's definitely adorable.
But I sent Tony a picture. He thought he was cute. He wasn't uptight at all.
At least he got back to you,
Can you see it?
There you go. Yep, right. Yep, there he is.
There he is.
Yep.
The doormen in my building, my apartment building, call him Mr. Fauci.
Okay.
They said he has an attitude, and they think he should be a Mr.
Wonderful. Well, Secretary, it was fascinating listening to your story, have you share your knowledge on all these important topics.
Well, thank you. part of my interest is always leadership.
Yeah.
And I tell my students stories about leadership. My favorite one is about the vaccines, because, presidents campaign on different issues. And Bill Clinton had promised everybody that he would make sure kids got their vaccines at the right time. Most kids get their vaccines by the time they start school, but we really needed to get them their vaccines before they were 3 under the new science. I don't think we had 50% that were getting it on time. And he said to me, that'd be a great thing to run on for my second term. He said, do you think you can get all the kids immunized by the time they're 3? And I said, yeah, I think I can do it. So I went to talk to the public health people in the department, and they said there was no way. They actually said no.
No.
I mean, this is a big meeting of public health people. They said, first of all, the parents don't know even the names. He said, second, the pediatricians don't give the shots. The public health people do. A lot of the people that have small babies don't want to go back and forth. They can't afford the vaccine. So we went to Congress and we got money to make the vaccines very inexpensive. And we talked to the pediatricians about giving the shots. But in that meeting, and the reason the dog story becomes important, I had a dog named Bucky. He was named Bucky Badger because I came from Wisconsin. And I pulled out a postcard in that meeting where everybody was saying no to me that came from my dog's vet. And it said, "Dear Bucky, time for your next shot." And I said, look, if the vets in this country can get all the dogs and all the cats and all the sheep and all the cows vaccinated at the right time without universal health care, we can figure out a way to get the kids vaccinated. And they all laughed. And Bucky should have gotten an award because we figured out how to do it. We even got the tray liners in McDonald's to print the schedules. And the first ladies in every state governor's offices took on the responsibility. I remember George Bush had shots for tots in Texas. It was bipartisan. We simply did a full court press. My nickname is Boom Boom because I like attracting issues from different directions. So I talked the Gerber's people into putting it on the back of their boxes. I mean, we used every communications, and we built a tracking system. So if a kid wandered into an emergency room, they could look on their computer and see what shot they were eligible for next. And we even ran a campaign with the Mexican health secretary along the border with cards. So if any of those kids came to the United States, they would have a card that would tell the doctors and the public health people what shots they had already had. And we learned a lot from developing countries who had these big vaccine days. But we got everybody their shots on time. And President Clinton loved that. He loved the fact that American kids were healthier. They were also wealthier because we did welfare reform and other kinds of economics issues. But that story about pulling out the card that my dog Bucky had gotten, the students loved because it shows how you can link things and what kind of a leader is persistent about getting things done.
Absolutely. That's a great story. It's a great story. It's fascinating. I look forward to continuing, to watch, your journey and everything that you're doing and teaching and representing companies in both the public and private sector. For everybody, again, that is going to be listening to this episode across the podcast networks or watching on the YouTube channel, and you've been listening to public servant, scholar, teacher, administrator, the Honorable Secretary, Dr. Donna Shalala. Secretary Shalala, I thank you again for taking the time out of your schedule to come talk to us for a little while about all these issues. Obviously, thank you for everything that you've been doing. And as we say on our show, thank you for having spent so much time creating a better tomorrow for people in this country and around the world. It's a really wonderful story.
Well, thank you.
Good seeing you.